Welcome to our live stream, Deuk Spine Institute. I'm Dr. Deukmedjian, neurosurgeon. Our patient has carpal tunnel syndrome. It's a pinched nerve in the palm of the hand. He's already had the right hand treated 2 weeks ago. Now we're here to do the left side. Many people get carpal tunnel syndrome on both hands. Some just get it on one. This patient has it in both hands. We don't do both hands at the same time. We like to treat one hand at a time. He chose to have the right hand done first. So now we're going to fix his left hand. He's very happy with the results of the right hand. His numbness is almost gone. He no longer has pain. Are these the proper loops for shorter?
No, that's a lumbar. Last time you used a cervical and you requested it.
Let's get started. So I'm going to make an incision. I'm using loops incision. All right. I make an incision, and you want to go all the way down to the fascia that runs from one side of the base of the palm to the other. Transverse carpal ligament. And then I'm going to put this retractor in, and you make the incision to perfectly fit this retractor. And I put the retractor in just like this. It's the perfect retractor for this type of surgery. Carpal tunnel release. I do mine open because endoscopic carpal tunnel release has a very high failure rate. 15 blade. And you can see down there is that transverse carpal ligament. I'm going to cut through it using a 15 blade until I get to see the nerve. And retractor. Sometimes the fat in the palm will actually get in the way. I don't know if you guys can see that, Henry.
Yes, we can.
It's probably hard. The
We can
biggest
see.
mistake surgeons make is they don't go all the way through. Okay, you have to go all the way through this ligament. I'm almost there. Suction. Try to straighten that retractor out, Luis. There is the transverse carpal ligament. Very deep in this hand. There it is. So we're through. I'm sorry you guys can't see better. But there's the median nerve. Heavy scissors. So now I have to finish releasing this ligament both towards the wrist and towards the palm. You got a lot of fat down there. It's a very common place to have fat. Fat serves as energy storage, but it also serves as a padding in our bodies. And when you have a lot of fat in the palm here, it just makes the surgery a little more challenging. Here's the median nerve. Pretty thick. Let's check this way. So I'm just fitting it out. Yeah. Let me have a 15 blade. And I think we're done. It looks good. All right. Done. We've gotten the pressure off the nerve. At this point, the only closure we do is in the skin. And it's a nice, you have a 3/0, right? I usually like a 2/0 nylon, by the way. Is it? Oh, good. All right. Let me sit down. I'm going to put a mattress type incision or suture where you go, you really want to take the tension off the skin edges to make this thing heal the best. Now, it always looks ugly for the first, few months. And it looks all tented up and people wonder, why does it look so bad? But the reality is, it looks bad just for a few months and then it all flattens out once all the swelling goes down. So you do a wide and then you go narrow, skin edge to skin edge. I'm just trying to evert the edges here. You want the edges pushed upwards. Yeah, I think Luis, the focal distance. And I think it may still be too far. We may have to get it shorter. So I'm doing what's called an instrument tie, where I'm tying my knots using this instrument. Nice and long. Thank you. I usually put about 4 stitches. Any questions?
At this moment, no current questions.
All right, so far, so good. Now he also has a tourniquet on, in case you're wondering why isn't there any bleeding. Tourniquet is this, like a blood pressure cuff on the arm that blocks the arterial blood from making its way down here so that I can do the surgery without blood everywhere. The reason is the palm is extremely vascular, lots of blood supply. So if I didn't have a tourniquet right now, this thing would be bleeding like absolute mad. All you'd see is red. Wouldn't be able to do the surgery. So the development of the tourniquet was a huge improvement for extremity type surgery. Long? Any questions?
At this moment, no current questions.
All right, well, a lot of people are surprised when they find out Dr. Deukmedjian does carpal tunnel release, but I was trained as a neurosurgeon first and foremost, so I learned all the basic neurosurgical procedures. That includes brain surgery, folks, like tumors, aneurysms, ABMs, shunts, treating hydrocephalus, all kinds of stuff. But as most neurosurgeons do, I specialized into what I did well and enjoyed doing, and honestly what most people need, which is spine surgery. And that's what I do now. My focus is primarily spine surgery. All right, cut long, we're done. Great job, everyone. We're gonna wrap this in an ACE bandage. We're gonna put some Curlex first, some tweeners. Thank you, everyone. Thanks for joining us. Carpal tunnel release.